Assalamu alaikum, everyone. I'm Dr. Lubna. I am a board certified internal medicine doctor and I practice internal medicine here for past 20 years. I thank Jinnah Sindh Medical University Association of North America for giving me this opportunity to talk about a very important topic, that is women's health, especially around the age of menopause and the predisposed conditions related to women's health around that age. Thank you, and now we will start our presentation. Today's topic is women's health, especially around menopause and the predisposed conditions associated at that particular age. Women's health, what we need to know. I'm going to start with breast cancer, and the first thing that I'm going to talk about is in the form of a patient's case. 65-year-old female seen after 10 years on a routine physical as she got her Medicare. Medicare is a government-funded insurance for the elderly here in the United States. Upon asking, revealed no complaints, and the exam was unremarkable except for a questionable growth on upper quadrant of left breast. At this point, I would like to advise the students who are planning to take the USMLE. Please listen very carefully about, some pointers that you might experience, when you take the exam, and those are going to be very helpful, those clinical pros. So listen very carefully. The incidence of breast cancer, it is the second leading cause of death after lung cancer. In the United States, 182,000 women diagnosed annually, and more than 40,000 women die of breast cancer. What is the incidence, and is it declining? The answer is yes, it is declining because there's more screening which is happening and there's reduction in hormone replacement therapy. Like I said, decrease in mortality because of more screening, adjuvant therapy, seen more in white than in Black women here in the US. The risks for breast cancer. There are certain defined risks for breast cancer. The most important, which is known risk for breast cancer, are the inherited abnormalities in BRCA1 and BRCA2 gene mutation. And the second is post-menopausal hormone replacement therapy. The others could be relevant. We're going to talk about that. Being younger than 12, when first menstrual period occurs, being older than 30 years at birth of first child, and older age at menopause. Risk for breast cancer, like I earlier said, post-menopausal hormone replacement therapy, alcohol intake 2 to 5 drinks per day, increased breast density on mammogram. For women who have increased breast density on mammogram, it is recommended to do the MRI of the breasts. Being obese, hyperplasia with and without atypia on breast biopsy, mother, sister with breast or ovarian cancer, age 80% of the breast cancer occur after the age of 50. What screening test used to detect breast cancer? It is the mammogram, but what is a screening test? Cancer screening refers to the use of tests to detect cancer at an early age before it causes symptoms and hopefully at the time when it's curable. The death rate from breast cancer has declined about 20% over the past decade due to increased screening, being able to find the disease at an earlier age when the chances of successful recovery are higher. So what are the screening tools? The gold standard is mammography, clinical breast exam, breast self-examination. What is a mammogram? A mammogram is a breast X-ray. The mammogram is interpreted by a radiologist. The abnormalities that radiologists typically look for on mammograms are calcifications and masses. Now, this is a normal mammogram. As you can see, the texture of the subcutaneous fat, glandular body, Cooper's ligaments, nipple, everything seems very homogeneous and uniform. There is no retraction of the nipple. There's no skin thickening or microcalcifications or dominant masses noted in this mammogram. And this is an abnormal mammogram. It shows a mass that was later, this is the mass here, this was later determined to be cancerous. And you look at the abnormal features here, the irregular, jagged edges and the distortion of the nipple and thickening of the skin here. So this is how an abnormal mammogram looks like. So what is clinical breast exam? Clinical breast exam is done by the general provider or healthcare provider, typically at the time of yearly physical examination. You inspect the breast for any changes in size or shape, and then palpate the breast and the area under the both arms for any changes in the texture or lumps. Studies show that about 50% of the breast cancers found on screening were detected by both examinations and mammography. Breast self-examination is done by women themselves. Women of reproductive age, they should do self-breast exam typically a week after the menstrual period, and women who are post-menopausal, they can perform the exam at any time. How to perform the self-breast exam? Start by standing in front of the mirror, place both hands on the hips, examine the breast for changes in skin color, texture, dimpling, and note how the nipples look. Some women have inverted nipples. This is not an abnormal finding as long as this appearance does not change over time. Lift the hands above the head and turn to the side to examine the entire breast in front of the mirror. If necessary, lift each breast to examine the skin under the breast. Lie down and put the left hand above the head. Use the right hand to examine the left breast. You will use the tips of the fingers to press the breast tissue against the chest, moving in a circular direction. Switch hands and repeat the examination on the right breast. The bottom line, breast cancer is not a death sentence. If we properly screen, then we can save many lives. But if not, then it may end the life of a woman at an early age and prematurely. Mammograms have the highest rate of detecting breast cancer. Most North American expert groups suggest that women over the age of 50 should be screened every year. Now, ovarian cancer. This is another cancer which is related to older age. And it is mostly seen in women who have one or more relatives with ovarian cancer, who've never been pregnant, very high risk family history, one case of breast cancer 40 years in a first degree relative or a second degree relative, one first degree relative or second degree relative with breast and ovarian cancer. Osteoporosis. Causes of osteoporosis: menopause-related loss of estrogen, age-related bone loss, certain conditions such as hyperthyroidism, vitamin B12 deficiency, hyperparathyroidism, medications such as medications for seizure disorders, chemotherapy, thyroid medication, steroids, cigarette smoking. Other risk factors are cigarette smoking, long-term use of steroids, like I mentioned, history of a non-traumatic bone fracture in self or parents, low body weight, excessive alcohol consumption, diseases like rheumatoid arthritis. And common fractures occur in hip, spine, and wrist. How do you diagnose? Medical history is important, such as history of pregnancies, age at first menstrual period, and menopause, past or present medical conditions, medications, calcium intake, exercise, alcohol and tobacco use history. The physical examination is measurement of height and weight and certain labs, bone density measurements. Now, as you can see in this bone density measure, the bones are cortical and trabecular bone. This is a normal bone, and it is normal, the cortical bone, the normally dense and the compact bone, which is the outer part here, and the trabecular bone, which is the inner part here. As you can see, the thinning of the cortical bone and disappearance of the trabecular bone causes a compression fracture. Fracture affected bone, and as you can see, it can cause increased curvature of the spine, which is called kyphosis. How do you interpret bone density? How do you interpret osteoporosis uh, or bone density? Normal bone density, osteopenia, or osteoporosis? When to measure the bone density? The bone density should be done in women greater than 65 years of age, under 65, who have one or more risk factors for osteoporotic fractures in addition to menopause, with a non-traumatic fracture, history with a non-traumatic fracture, history with a disease associated with low bone mass, taking medications associated with low bone mass. How can we prevent osteoporosis and its treatment? There is non-drug prevention and treatment, and then there are medications. The non-drug prevention and treatment include calcium intake, vitamin D intake, protein supplements, limiting alcohol consumption, increasing exercise, smoking cessation, and preventing falls. A little bit about preventing falls. How can you prevent falls? Remove loose rugs and electric cords or any other loose items in your home that could lead to tripping, slipping, or falling. Ensure that there is adequate lighting in all areas inside and around the home. Avoid walking on wet or polished floors or other potentially slippery surfaces. Avoid walking in unfamiliar areas outside. The medications used to improve osteoporosis are biphosphonates. Biphosphonates are the most commonly used medications for treatment of osteoporosis. Then there are injectables also, such as reclast and estrogen-like medications, estrogen progesterone therapy, so on and so forth. Biphosphonates, how do they work? They inhibit the breakdown and removal of bone. These drugs need to be taken first thing in the morning on an empty stomach with a full 8 ounces glass of plain water, not sparkling water. The common side effects of biphosphonates are typically stomach upset or gastritis-like symptoms. Who needs treatment with the medication? Woman with history of osteoporosis who has a hip or a vertebral fracture, prior fractures, and T-score. This is how you measure osteoporosis, with a T-score. It's a negative measurement. T-score of -1.0 and -2.5 at the femoral neck, total hip, or spine. Total score of -2.5 at the femoral neck, total hip, or spine. How do you monitor the response of the treatment? Experts recommend repeating the bone density after 1 year of treatment. Now let's just talk about menopausal symptoms. Another patient case. A 55-year-old female who ceased to have periods for last 6 months presented with drenching night sweats, hot flashes, and mood changes. Medical workup is unremarkable. What is menopause? Menopause is defined as a time in a woman's life, usually between 45 and 55 years of age, when the ovaries stop producing eggs and menstrual periods end. The average age of menopause is between 50 and 51 years. The symptoms of hot flashes are hot flashes, vaginal and urinary symptoms. Other symptoms could be fatigue, irritability, difficulty concentrating, and mood swings. Hot flashes occur because of a fall of estrogen levels. begins several years before menopause and may continue for several years after menopause. More common at night when they can cause night sweats. Estrogen is the most effective treatment available for hot flashes. What is hormone therapy? It's the term used to describe the two hormones, estrogen and relieves the symptoms. Women with a uterus must also take progestin to prevent uterine cancer. There are certain types of estrogen and progesterone preparations: estrogen pill, estrogen patch, vaginal estrogens, oral progestins, intrauterine progesterone. And then there are certain natural and bioidentical hormones. These are generally referred to the use of individual dose of hormones, but there's no evidence that these hormones have any advantage over conventional hormone therapies, and their safety has not been established. Who should take hormone therapy? Consider hormone therapy to treat bothersome symptoms such as hot flashes. And it should be taken for the shortest period of time possible. And who should avoid estrogen? Very important. Someone who has current or past history of breast cancer, with history of coronary artery disease, someone who has previous history of blood clots or stroke. Women at high risk for these complications should avoid hormone replacement therapy. What are the other alternatives besides hormone replacement therapies for controlling hot flashes? We can use certain antidepressants, medications such as clonidine, gabapentin, and there are some plant-derived estrogens, phytoestrogen, isoflavonoids, so on and so forth. There's no evidence of safety in such alternative treatments. Vaginal dryness usually is moisturizer, lubricants, and topical estrogen creams. Cardiovascular health. I really want to talk about this very briefly because this is something really important. Cardiovascular risks are the most common cause of death and disability in women in the United States. The incidence of myocardial infarction in women, although lower in men, increases dramatically after menopause. Cardiovascular risk factors in women, especially age over 55, personal history of heart disease, dyslipidemia, which is high LDL, low HDL, family history of premature heart disease, first degree male relative under the age of 55, or a female under the age of 65. Conditions such as diabetes, smoking, hypertension, peripheral vascular disease, they're all risk factors for cardiovascular risk disease in women. Recommendations: moderate intensity physical activity for at least 30 minutes and for 60 to 90 minutes for weight management on most days of the week. Weight maintenance, reduction to achieve a normal BMI between 19 and 25, and a waist circumference less than 35 is optimal. Treat dyslipidemias, hypertension, and diabetes. Personal goals should be age with grace and delay the onset of age-related disease and discomfort by developing the lifestyle practices essential to experiencing optimal health. Minimize unhealthy stress, connect with others, and keep your mind sharp. 10 keys to healthy aging. Be active. Stop smoking. Participate in cancer screening. Lower cholesterol. Control blood pressure. Control diabetes. Prevent bone and muscle loss. Maintain social contact. Treat depression. Get immunized. There are certain cartoons I would like to share with you. Now, this gentleman, he is only 25 years of age. And he's saying, hey, you know what? I've been smoking all my life. And the doctor's saying, hey, but you're only 25. And this is one of my favorite cartoons. You must have heard of, Snow White and Seven Dwarfs. These are seven menopausal dwarfs, which are itchy, bitchy, sweaty, bloaty, sleepy, forgetful, and psycho. Well, this educational activity is supported by Jinnah Sindh Medical University Association of North America, and I thank you for this opportunity. And I hope this was useful for our medical students at Jinnah Sindh Medical University. Please be safe, practice social distancing, and have a very good weekend. Thank you so much.